Welcome to Graduate Certificate in Diabetes Education and Healthcare Information Session. This is what we are going to cover in today's session. Acknowledgement of country, Mayfield Education, who we are, why diabetes education, the role and scope of credentialed diabetes educators, program structure and information, how the program would be delivered, the assessment methods, student workload, entry criteria, document required, dates and last day to apply, scholarships, award fee, and questions. In spirit of reconciliation, Mayfield Education acknowledges the traditional custodians of the country throughout Australia and their connections to land, sea, and community. We pay our respects to their elders, past and present, and extend that respects to all Aboriginal and Torres Strait Islander people who are attending this session today. Mayfield Education is Victoria's leading not-for-profit vocational education provider for health and community services sector. We are in education last 50 years. We are a private institute of higher education and a registered training organization. Mayfield is run by healthcare professionals for healthcare professionals, and we are one of the first providers of diabetes education program all over Australia, and we've been delivering this program last 30 years. We are located at Camberwell Road in Hawthorne East, Victoria. We are only 12.9 kilometers in the east of Melbourne, and we are located only 400 meters away from the Auburn station in the Melbourne Metro, in the Belgrave and Lilydale line. These are some of the unfortunate statistics about people living with diabetes in Australia. 1.9 million people are already living with diabetes in Australia. Only 1.5 million is known and registered. 120,000 people are diagnosed with diabetes each year, unfortunately, and that accounts for massive 300 Australians every day and one person in every 5 minutes. 400,000 Australians are already living with high risk of diabetes. If you got a passion to help these people, this would be a cause. Look at the World Diabetes Day theme in the recent year, diabetes education to protect tomorrow. Credentialed diabetes educators are healthcare providers that has been recognized by Australian Diabetes Educators Association for their special knowledge and professional development in the diabetes education. They provide structured education to those people who are living with diabetes or who are actually at risk of diabetes. Credentialed diabetes educators also supports family members and carers. Credentialed diabetes educators such status is actually recognized by National Diabetes Service Scheme, Medicare Australia, Department of Veteran Affairs, and some private health insurance as providers of diabetes education. The ADA credentialing program is a certification and professional development program for credentialed diabetes educators. To become a CDE, a healthcare professional must complete an ADA accredited postgraduate course, that is graduate certificate in diabetes education and healthcare with Mayfield or any of the other providers. You must be completing 1,000 hours of practice in diabetes education, and you must take a minimum of like 6 months of mentoring program by an experienced CDE. To maintain the CDE status, CDEs should actually show a minimum of 20 hours of professional development per year. You might already know this. A credentialed diabetes educators may work in hospitals, community health centers, medical centers, or in private practice, and they basically empower people to effectively self-manage their diabetes. A CDE can provide support and assistance for those living with diabetes. Education and training, clinical care and management, information, knowledge, skills, and strategies can be imparted. Assistance with self-management goals, and they can actually register people living with diabetes to NDSS. With the Mayfield program, we got 4 units for the entire course. Unit 1 is Management of Diabetes. Unit 2 is Psychological and Special Needs in Diabetes Education. Unit 3 is Teaching and Learning. And Unit 4 is Evidence-Based Best Practice and Diabetes Education. This actually tells you what's actually covered in each unit. So if you are interested to know more, like you can just pause it and just understand like what's actually covered in like each unit. The delivery of program at Mayfield is blended. We got online components and like 12-day of face-to-face practical workshops. For each and every unit, students will be attending 3 days on site in campus at Mayfield Education for the practical workshops. 60 hours of placement is required. The formal clinical placement will be for 40 hours, and like 20 hours of additional professional practice exposure, like seminars, attending the online modules, attending some like diabetes camps. Those kind of like things will actually make like 20 hours of additional professional practice exposure. The assessments of this course include landmark study quiz, case studies, study quiz, written assessment, short answer review, class presentation, reflective journal, class presentation, critical analysis, project plan, and like change plans. As part of this program, students will be spending like at least 10 to 12 hours in a week uh, to successfully complete this program. In order to qualify this program, you must be having minimum of 2 years of postgraduate experience as a registered nurse, accredited practicing dietitian, registered midwife, direct entry midwife, registered podiatrist, registered pharmacist, accredited exercise physiologist, registered physiotherapist, medical practitioners, or as an optometrist. For applicant with Aboriginal or Torres Strait Islander background, who are enrolled nurses, allied health workers, and health practitioners, they can apply to Australian Diabetes Education for an eligibility assessment by submitting evidence that the applicant meets the criteria as per the link. You can look up the link and provide a submission to ADA directly. In order to apply, you need to have like a relevant application form. You need to attach your CV. You need to compile a 200 to 250 words statement why you want to do this program. You need to provide 2 years of full-time employment. That's like after the graduation. You need to provide us like a verification of current employment status, certified copies of qualification and transcript, certified copies of 100 points of ID, and registration certificate either with APRA, DAA, or ESSA. Our next intake is Intake 1 2024. These are the proposed face-to-face block dates. This actually falls on Wednesday, Thursday, and Fridays. There are totally 4 blocks. The block date of Unit 1 is 6, 7, 8 of March 2024. The block date for Unit 2 would be 5, 6, and 7 of June 2024. Block date of Unit 3 would be 4, 5, and 6 of September 2024, and block date for Unit 4 would be 4, 5, and 6 of December 2024. The commencement date for the next intake would be 4th of March, so you should be making the application before 20th of February in order to secure a place in the program. Various scholarships are available for the students through RCNA website, Diabetes Victoria website, and Nurses Memorial Center. Once the course is completed, you will be awarded AQF Framework Level 8 Postgraduate Certificate. It will be named as Graduate Certificate in Diabetes Education and Healthcare. So the tuition fee for the program is 10 grants 550. Also, $450 is actually charged for the student amenities. The initial course deposit via electronic transfer is like $250 to secure the place, and monthly direct debit installments. The plan starts at like $895 paid monthly. If you need more information, there is the link where you can visit for the fee structure. If you got any specific questions that you need to clarify, please email us at decc@mayfield.edu.au, and our diabetes educator will get in touch with you directly. We look forward to having you on board, and we wish you a great learning experience with Mayfield Education.